This is part 4 on the role transition lecture. We'll talk about leadership styles. So leadership is the art of motivating a group of people toward achieving a common goal. That's the basic definition. It's a behavior that an individual does to influence another. So with our autocratic leadership, also called authoritarian leadership, this person is very firm, insistent, self-assured, dominating. They are it's my way or the highway type of person in this role. This type of leadership is decreasing, thankfully. Nurses want more of a say in decision making, which we should, but it was seen a lot with the baby boomer generation, with how their leadership skills were. We had a nurse when I worked on COU back in the day that they called her Sarge, kind of short for drill sergeant. Nice lady, excellent nurse, but when she was in charge, it was autocratic leadership. There is usually a high turnover with leadership styles like this, and also burnout. Democratic, also called participative leadership. So everyone's encouraged to work together. Teamwork is encouraged. So they work together to accomplish their goals and outcomes. Nurses like this type of leadership, and there's usually group satisfaction and motivation. Laissez-faire would also be called non-directive leadership. Independent activity is encouraged. It can be used when all staff are experts. They have a good understanding of how things are supposed to work. But this type of leadership is rarely ever used. Then we have servant leadership. With this type of leadership, they want to improve the lives of others and the facility. They want a more just and caring workplace. Some more leadership styles. We have quantum leadership. With leaders portraying quantum leadership, they view the organization and everyone involved, all the members of the organization, as interconnected and working together. They want to make sure that their employees stay up to date with nursing, and that things run smoothly. Transformational, these leaders challenge themselves and others to grow. They are passionate in their role. They have a vision for the future. They try to engage others. They pay attention to the process and the outcomes. They're very positive. They look for an improved culture of nursing practice and patient care. Magnet facilities often possess this style of leadership. Whereas we have transactional leadership, employees under leadership of this type have minimal opportunities for involvement in organizational decision making. The employer and employees may not share the same vision. These type of leaders provide little inspiration for nurses to participate in reforming healthcare, solving problems, research, so evidence-based practice, or promoting nursing excellence. They do not promote nursing excellence. And then nurse as researcher. We need nurse researchers out there. So if anyone wants to continue on and further their education to become a researcher, I highly encourage you. They are involved in clinical trials. They work directly with patients. They have excellent clinical skills. And again, it's through nursing research that the profession can say we are backed by evidence-based practice, evidence-based research. Nurse educator, of course, can work in an educational, school of nursing setting. Or you can work in staff development, so education in a facility, or a nurse educator of patients, such as a diabetic educator. There used to be a congestive heart failure clinic at the hospital with a nurse, running that under doctor supervision, but the nurse was running it, educating patients. And then nurse as manager. So you could be a director of nursing somewhere, assistant director of nursing. You would have a lot of authority over your area and power, specific duties, responsibilities to make decisions for budgeting, trying to balance meeting organizational goals and keeping their staff happy. They do help to provide direction to their group, their unit, their department. Now we have some questions. So which is an example of an internal barrier to role development? A would definitely be fear of failure. B, lack of confidence. And E, feelings of being overwhelmed as internal. External would be C and D. So the reality of role development and role transition regarding the decision to return to school to assure a career as a professional nurse is that the decision will result in a major life change. That would be true. Last slide, we have the legal nursing practice of the RN differs from that of the LPN, primarily in the area of autonomy. It's working independently. True or false? And that would be true, as the RN is an autonomous nursing provider.